Well, hello. Today I wanted to visit with you about the benefits of hospice in the nursing facility. Many people don't know and understand that hospice can be and is very often provided to residents residing in nursing facilities and assisted living facilities, and it's a wonderful, wonderful benefit to the resident as well as the family and also the staff of the facility when hospice is involved. Let's look first at who those residents are in either the nursing home or assisted living facilities who may benefit from hospice. There is a national statistic that states that at any point in time, approximately 10% of those residents in assisted living and nursing facilities would qualify for hospice. Who might they be then? Those residents in nursing facilities and assisted living facilities who may qualify for hospice include those who may be experiencing adult failure to thrive, who may have a history of falls or other injuries, who have Alzheimer's dementia, who have lung disease, chronic heart disease, and also those people who, for any unknown reason, are experiencing weight losses and skin integrity issues. All of these people deserve a look to see if they qualify for hospice. And the good news is, if they do qualify for hospice, then hospice services can be provided within the nursing facility setting. What does that mean for nursing homes and assisted living facilities? The biggest benefit to our nursing facility and assisted living facility partners is that you regain or maintain complete control of your resident. With hospice, because hospice has the primary intent of serving the patient in their home setting and keeping them in that home setting through the final day of their life, then hospitalization is probably not going to happen. It happens very, very rarely when hospice is involved. So that means your resident stays in their home environment and you have very minimal risk of losing nursing facility days to the hospital or another care environment. It's a wonderful, wonderful thing, and what I consider to be a win-win. It's a winning situation for the patient and their family, and also for the nursing facility. Other things that your facility will gain from hospice being involved is that hospice guides the plan of care. So, for all decisions related to the end-of-life diagnosis, the terminal diagnosis, you can bank on Abundant Life Hospice being there to serve your patient and their family and to identify the best and usually the simplest mode of care for managing pain and other symptoms and improving quality of life. It's a wonderful, wonderful thing when this happens. Also, continuous care is available for times of acute exacerbation of symptoms that the resident may experience, and also for imminent end of life. And so what that means is that in either of these situations, Abundant Life Hospice could put a nurse at the bedside for 8 hours or more. We take over dosing of medications, contacting and communicating with the physician, coordinating the care plan with the facility, teaching your team what they need to know about how to manage that acute exacerbation of illness and what's going on with it. And we're there to manage the entire episode. That frees up the facility team then to manage everyone else in the building. As much as we know they would love to be able to drop everything and be there at the bedside of this one resident, we all know how time-consuming and cumbersome that can be, and this is one of the true benefits of hospice. So remember that continuous care is available for residents in the nursing home and assisted living facilities for acute exacerbation of symptoms and for imminent end of life. When continuous care is used for imminent end of life, it's a wonderful, wonderful thing to share in the care of our mutual patient, and for that family then to see that your facility has done everything possible to promote an optimal, peaceful, pain-free death for their loved one. These are just a few talking points on the benefits of hospice in the nursing home. I hope this information is useful to you. Continue to call me with your questions or comments. Email me with questions that you might have and further content that I might use on these weekly video messages. Thanks so much, and God bless your week. Bye-bye.